If you are over 60, pay attention to something very important about senior health. Have you ever woken up at night and noticed that your feet feel numb and stiff? Or when lying down to rest, the soles of your feet feel hot, as if they are being lightly burned? Or sometimes you feel a small electric sensation running through your toes. Many seniors think this is simply a normal sign of aging. But in many cases, sensations like numb feet and tingling, burning, or prickling in the feet may be related to peripheral neuropathy, also known as neuropathy in feet. What's notable is this: many people over 60 only realize the problem when the symptoms have already lasted for many years. A neurosurgeon once said something that surprised many patients. What makes peripheral neuropathy worse after the age of 60 is sometimes not a new disease, but the fact that the nerves and blood vessels in the feet are no longer being properly activated each day. When the small muscles in the feet move less, blood circulation that nourishes the nerves decreases. Over time, this can cause sensations of neuropathy in feet, such as numbness, tingling, or burning, to appear more frequently. The good news is that, in many cases, simple movements from the group of neuropathy exercises for feet can help improve nerve circulation, support circulation, and activate the small muscles that we rarely use. In today's senior health video, you will discover 3 important things for people over 60. One early sign of peripheral neuropathy that many people overlook. A common mistake that causes numb feet and tingling to become worse over time. And one of the simplest exercises for seniors, often recommended to help improve nerve circulation in the feet. It only takes a few minutes each day, but this exercise can help many seniors begin taking better care of the nerve health of their feet.
Before we talk about exercises for seniors that can help improve nerve circulation, let's try a very quick test to see how the nerves in your feet are functioning. This 30-second nerve test is used by many senior health specialists to help people over 60 recognize early signs of peripheral neuropathy or neuropathy in feet. You can do it right now. Step 1. Stand upright behind a chair to keep your balance if needed. Step 2. Close your eyes for about 10 seconds. Step 3. While standing, try to spread your toes apart, then gently curl them back. Now pay attention to the sensations in your feet. Do you feel difficulty controlling your toes? Sensations of numb feet and tingling? Or your feet feeling slightly unsteady? If so, that may be an early sign that the nerves in your feet are not being fully activated. Don't worry, the important thing right now is recognizing it early so it can be improved with appropriate neuropathy exercises for feet designed for people who are senior and over 60. Remember the sensation you just experienced, because in the next section, we will talk about the thing that worries many people the most when neuropathy begins to appear.
In reality, for many people living with peripheral neuropathy or neuropathy in feet, the thing they fear most is not the pain. What worries them the most is that the condition will gradually become worse. Many people say that at first it is only a mild numb sensation. Then comes a burning sensation, followed by loss of feeling in the feet. When the nerves no longer send clear signals, maintaining balance while walking can become more difficult. In the field of senior health, experts often mention one reality. When peripheral neuropathy progresses, the risk of tripping or losing stability can increase, especially in people over 60. But the important news is this: many cases can be supported if we begin early with appropriate neuropathy exercises for feet and exercises for seniors that help improve nerve circulation. And to understand why this can be effective, we need to look at a truth that few people talk about regarding neuropathy.
Many people believe that once they have peripheral neuropathy or neuropathy in feet, the nerves are already damaged and cannot improve anymore. But in many cases, the problem does not lie only in the nerves themselves. Another important factor is blood circulation that nourishes the nerves. The nerves in the feet need a stable supply of oxygen and nutrients to function. When circulation decreases, nerve signals can become weaker, leading to sensations such as numb feet and tingling, burning, or prickling. In people over 60, the muscles in the feet and calves are often activated less frequently. This causes the blood flow that nourishes the nerves to gradually decrease over time. That is why many senior health experts encourage exercises for seniors that help improve nerve circulation. However, before we move to the most important exercise, we need to talk about 3 very common mistakes that can make neuropathy worse.
Mistake number 1, relying only on walking. Walking is good for senior health, but specifically for neuropathy in feet, walking often does not activate enough of the small muscles in the feet. These muscles are very important for supporting nerve circulation. Mistake number 2, sitting for too long during the day. When we sit for hours, blood flow to the feet slows down. This can cause sensations of numb feet and tingling to appear more frequently. Mistake number 3, not focusing on exercises specifically for the feet. Many people over 60 exercise, but overlook neuropathy exercises for feet, a group of exercises for seniors that help activate the small nerves in the feet. When these 3 habits continue over time, nerve circulation may gradually decrease. And to better understand why activating the muscles is so important, we need to talk about an interesting concept that many senior health experts call the second heart of the body.
In our body, the calf muscles and the muscles in the feet function like a natural pump. Every time these muscles contract, they help push blood from the feet back to the heart. Because of this important function, many experts call them the second heart. But as we grow older, especially over 60, these muscles often become less active. When the second heart becomes weaker, blood flow to the feet also circulates less effectively. This can reduce the amount of oxygen and nutrients that nourish the nerves, leading to familiar symptoms of peripheral neuropathy, such as neuropathy in feet, sensations of numb feet and tingling, or burning in the soles of the feet. The good news is that the right exercises for seniors can reactivate the second heart, helping improve nerve circulation naturally. And in the next section, right after this, you will learn one of the simplest yet most effective neuropathy exercises for feet that many experts recommend seniors practice every day.
This exercise is called toe spread and squeeze. The goal of this movement is to activate the small muscles in the feet, muscles that are often rarely used but play an important role in helping improve nerve circulation. The method is very simple. Step 1. Sit upright on a chair with both feet placed comfortably on the floor. Step 2. Spread your toes apart as much as possible and hold for 5 seconds. Step 3. Then gently squeeze your toes together and hold for another 5 seconds. Repeat this movement about 10 times. This is one of the exercises for seniors that helps activate more than 20 small muscles in the feet, supports circulation, and may help reduce the sensation of numb feet and tingling commonly experienced by people with peripheral neuropathy or neuropathy in feet. But how do you know if you are doing it correctly? In the next section, we will talk about the sensations your body should notice when this exercise is performed properly.
As mentioned in the previous section, when you perform the toe spread and squeeze exercise correctly, your body will usually send a few small signals showing that the muscles and nerves are being activated properly. For many senior adults over 60, after repeating this neuropathy exercise for feet a few times, you may begin to notice some slight changes. First, the soles of your feet may feel a little warmer. This is a sign that blood circulation is improving and that the foot muscles are helping improve nerve circulation. Second, you may feel a mild tension in the arch of the foot or in the calves. This happens when the small muscles begin to become active again. Third, for some people with peripheral neuropathy or neuropathy in feet, the sensation of numb feet and tingling may gradually decrease after a few minutes of exercise. That is why many senior health experts encourage people over 60 to practice simple exercises for seniors every day.
And for these neuropathy exercises for feet to truly bring benefits to senior health, the most important thing is not exercising for a long time, but maintaining a simple routine every day. The good news is that you only need about 3 minutes, which is very suitable for people over 60. You can perform this routine in the morning or in the evening. Minute 1. Perform toe spread and squeeze. Spread your toes apart, hold for 5 seconds, then squeeze them together for 5 seconds. Repeat about 10 times to activate the small muscles in the feet and begin to improve nerve circulation. Minute 2. Gently lift your heels up and lower them down while sitting. This movement helps activate the calves, the second heart that supports blood circulation. Minute 3. Curl your toes downward and then relax them, helping increase flexibility in the feet.
This short routine is one of the exercises for seniors that helps support the reduction of numb feet and tingling, which are commonly experienced by people with peripheral neuropathy or neuropathy in feet.
And as many senior adults over 60 often ask after starting this 3-minute routine, when can you begin to notice changes? For some people who practice these neuropathy exercises for feet consistently, the first signs of improvement may appear sooner than you think. In the first few days, many people notice that their feet feel a little warmer after exercising. This may be a sign that these exercises for seniors are helping to improve nerve circulation. After about 1 week, some people with peripheral neuropathy or neuropathy in feet report that they feel less numb feet and tingling, especially in the evening. Another change is that the feet feel more flexible when moving. The toes become easier to spread apart and curl compared to before. These small changes show that the muscles and nerves are beginning to become active again.
However, to better understand how the improvement process may unfold over time, let's look at the timeline of changes that many senior health experts often share with people over 60. Week 1 to 2. The feet may begin to feel warmer and more flexible. Some people may still experience numb feet and tingling, but the frequency may decrease slightly. Week 3 to 4. Some people with peripheral neuropathy or neuropathy in feet notice that the burning sensation in the soles of the feet gradually decreases, especially in the evening. Week 5 to 8. The toes become easier to move, and balance while standing or walking may improve. After 2 to 3 months. If maintained consistently, many senior adults notice that their feet respond better to movement and that nerve circulation becomes more stable.
And the important thing to remember is this: the body at the age of over 60 still has a remarkable ability to adapt. In the next section, we will talk about why there is still a great deal of hope for improving the nerve health of the feet. Many people believe that once peripheral neuropathy or neuropathy in feet appears, the nerves will only become weaker over time. But in reality, when the feet begin to be activated regularly through neuropathy exercises for feet, the body can still respond positively. The small muscles in the feet and the calves play an important role in helping to improve nerve circulation. When they work consistently, the blood supply that nourishes the nerves can improve over time. That is why many exercises for seniors focus on small movements repeated every day. For some senior adults, just a few minutes of proper movement each day can gradually help reduce the sensation of numb feet and tingling, while also improving the flexibility of the feet. The most important thing is not exercising a lot, but starting and maintaining a small daily habit.
And as I just mentioned about starting with small daily habits, this is the moment you can join a simple challenge with the senior health community watching this video. Before leaving the video, write your score in the comments section. Just write it very simply. For example, today, 2 points, or today, 3 points. Many people over 60 are sharing their experiences as they begin practicing exercises for seniors and neuropathy exercises for feet to improve nerve circulation. Some people say that at first they often felt numb feet and tingling, or signs of peripheral neuropathy and neuropathy in feet that made walking uncomfortable. But after maintaining the routine every day, many senior adults notice small changes over time. So write your score today, and after about 2 weeks, come back to this video to update your new result. It is very possible that your story will become motivation for other people over 60 who are starting their journey to improve the health of their feet. Thank you for watching, and see you in the next video.